We're now ready to move on to the live panel, and I am going to invite three panelists, two of which you've met earlier in this webinar series, and one new member who I'll introduce once everyone is on screen. So we have about 20 minutes for this session. We've been receiving a lot of questions through the Q&A platform, which we appreciate very much. And we continue to welcome those. So we've got about a 20-minute time frame, as I mentioned, set aside for this. So I would like to welcome again Jodi Hirschman, who, as a reminder, joined us at the very beginning of this webinar series. She's the research program manager for the OPTIMISTICC project. I'd like to welcome again Laura Porter, who is currently a co-investigator on Team OPTIMISTICC, also responsible for the recruitment and management of patient advocates on the project. And I'd like to welcome our newest member, Cynthia Sears, who is professor of medicine, oncology, and molecular microbiology and immunology at the Johns Hopkins University School of Medicine and the Bloomberg School of Public Health. Cynthia is also the microbiome project leader of the Bloomberg Kimmel Institute of Cancer Immunotherapy. So thank you all three of you for participating on this panel. As I mentioned, there's a number of questions coming as we speak. I'll try and catch as many as I can. But let me begin with a question that I think, Cynthia, I'll direct your way for starters. As part of the OPTIMISTICC research findings so far, have there been certain bacteria that have been found to be more strongly associated with late stage versus early stage colorectal cancers?
Yeah, thank you very much for having me on the panel. The answer is we don't have a clear answer to that question as yet. I think as we just heard Dr. Ng describing, we're at the very early stages of recruiting enough patients and samples to address the microbiome in early onset colorectal cancer. So most of the data I think we have is from individuals who are older at this point in time. I want to mention a very promising finding, and this is from Phil Quirke's work in Project 1 of the OPTIMISTICC project, and that is that the pattern of microbes that are been associated with colon cancer in the UK is similar to that being seen in multiple other geographic locales. So that I think is an encouraging sign to us. And I will say in our own research, the patterns that we've seen are similar at Johns Hopkins as in Malaysia. So that is positive about the ability to move forward and try to identify signals that we can use for prevention.
Perfect. I think I'm going to just bridge into a second question, which is also about bacteria, but Fusobacterium seems to be the most talked about bacterium in colorectal cancer. What do we actually know about it and its relationship with the disease?
So Fusobacterium burst on the scene about 10 years ago and was the first organism identified as associated with colon cancer through computational analyses versus other approaches that had been used in the decade, 1 to 2 decades before that. We know that's extraordinarily common in the tumor microenvironment where it seems to prosper. And so the challenge is to understand exactly what processes in the tumor environment it is changing, and can we disrupt those? There's early evidence that the presence of Fusobacterium in the tumor environment may be associated with a somewhat worse prognosis in some subsets of cancer, but the exact details of that are still under investigation. And that entire question got further complicated in the last couple of years because 4 distinct subspecies of Fusobacterium were identified that could not be appreciated in the early work done a decade ago. So we definitely have our work, cut out for us.
However, it's an advancement. I don't know, Jodi or Laura, is there any other comments that you'd like to add to Cynthia's around this subject?
No,
Thank
No.
you.
Thank you so much. I guess reinforcing, of course, the need for continued research. One of the things that has been a recurring theme, I think, through this entire webinar series is the emphasis on diet and lifestyle change, and some of the very deep, wonderful analyses that this project is bringing to the table. One of the questions we have here is, how long does it actually take to change your microbiome through diet or lifestyle changes? Is this something that is short-term? Does it take months? Does it take years? Is this something that needs further investigation? It seems like it's so fundamental to the management of the disease. What do we know about it? Yeah, and I'm happy to go with whoever feels most comfortable, or we can have a dialogue on it.
Well, there is some stellar work published by Gary Wu, again, about a decade ago, that I think to all of our surprise showed that within 24 to 48 hours after a change in diet. So if you decide you're going to be vegan today and you're going to eat meat tomorrow, in 2 days, your microbiome will shift. But what doesn't happen is sort of the core microbiome doesn't shift perfectly or durably. That's the piece we don't fully understand. We can see a real throwing the organisms up in the air, which to me says that we each have the capacity for a healthy microbiome, but the percentages of the bugs can be so tiny that we can't even see them. But after a diet change, all of a sudden they bloom. And then we have a change occurring, but making that change durable, I think, is the question, at least I don't know the answer to, and which I think needs more work. The other point I would make is there's some beautiful work by Dr. Keith out of Pittsburgh, who did a diet swap between African Americans in the United States and a Western diet, and individuals in Africa, which is more of a grain-based diet. And switching those diets for just 2 weeks completely modified the metabolic profile of the patient. So showing that diet changes have really dramatic and fast effects on our physiology.
I'd like to point out that the importance here is that it may change the microbiome, and it does obviously quickly, but we do not know if that changes your risk for developing colon cancer. And I think having been diagnosed at the age of 43, it was, difficult to try to figure out why I got colon cancer without a family history. And I think that what's important for patients, for us, is to know that we did not cause this disease, that it wasn't our diet, that it wasn't, we don't know why we developed colon cancer at such a young age, because most of the people that I know under the age of 40 even are healthy weight and, they're overall healthy. So I think that, to make changes in the microbiome, we're not sure what effect that will definitely have. And that's why we're doing this research. So
Thank you very much for reinforcing that. I certainly anecdotally, that's been my own personal experience with colleagues who've had colorectal cancer, is healthy individuals. Is there any relationship? I mean, we've talked a little bit about diet. Is there exercise or is there another significant lifestyle factor outside of diet that has been seen to be impactful on the microbiome at this stage? It's a little bit of, if diet's one, what's number two?
So virtually all the known risk factors for colon cancer are associated with microbiome change. So I sort of think about these features of health, and there is possibly a portion of the mechanism that's actually being dialed through the microbiome that we don't fully understand yet. And given that the microbiome may be modifiable, there's some evidence to suggest that this may be promising, both as a way to detect and prevent, as well as to augment other therapies. Diet isn't going to beat cancer, but it can perhaps help augment the efficacy of the therapies.
Well said. There's been several questions around, I'll call it prebiotics, probiotics. So let me frame it one different way. And the question essentially has been, what is the role of prebiotics? What is the role of probiotics in the microbiome? And is there evidence to support their use in colorectal cancer prevention?
So a prebiotic is a substance that is metabolized by the bacteria in the gut to create metabolites that are thought to support the health of the colonic epithelial cells. And those, of course, are the cells that become cancerous and cause the tumor. Probiotics are a collection, typically, of live microorganisms that are, quote, to have health benefit. I have to say that we do not have data to support advising either for patients at this time. And in fact, the data over the last few years, which is predominantly on the probiotic side of things, is not encouraging. And in fact, recent data that was published in Science in the last year identified probiotics as a negative risk factor for success of immunotherapy. So in other words, if the patient was on probiotics, they appeared to have less of a response to immunotherapy. So in the moment, I think we're on pause, and we would not encourage patients to take these adjuvant therapies because we don't know which ones might be helpful versus hurtful.
Yeah, it's, just from a lay person, there was a time when there was yogurt companies with big television campaigns saying, take this to improve your gut health. So that's proven to be perhaps questionable at this stage.
Well, I think yogurt's benign. There't two organisms that create yogurt, if you will. That appears to be benign. And I'm just going to say it's benign. So I don't want to discourage anybody from eating yogurt, because that is pretty good food for us.
Yes. Thank you. I'm going to bridge a little bit from lifestyle into Laura. I'm not sure if you're aiming to say something at this stage. No, you're good. Okay. Sometimes the video is a little bit lagged, but thank you. I'm going to bridge from lifestyle into a question that here is about from someone who actually is on cancer treatment, doesn't specifically say what kind of treatment, but does cancer treatment affect the microbiome? If so, is there anything I can do about it, either before or after treatment?
So the answer is probably yes. We have older evidence that certain chemotherapeutic agents, for example, were able to precipitate Clostridioides difficile diarrhea, classically known as an antibiotic-induced diarrheal disease. So we're suspect that that is a possibility. I don't think, at least I'm not aware of data that can direct us how to address that. But we pretty much assume in our analyses that individuals who we know have had multiple therapies over time, including very often antibiotics in a cancer patient where they could be life-saving, that the microbiome is not their baseline microbiome.
You know, it's a great bridge, Cynthia, into a question about antibiotic use, which is here as well. Antibiotic use has been increasing around the world in the past decades. How does this influence our microbiome? And is there association with colorectal cancer incidence?
So another great topic, and that is exactly the situation we're in, which is in part driving antimicrobial resistance. There are now about 6 studies that are fairly large epidemiologic studies done by different groups, including ourselves, as well as Dr. Andrew Chan at Harvard, that show that distant antibiotic use. So in the case of our study, 10 years before the onset of colon cancer, that there does appear to be an association between oral antibiotic use and the possibility of an uptick in risk. And was recently a study out of Finland. So the sense is that, you know, we used to say you take a course of antibiotics and your microbiome's back to normal in 3 months. And I think that's a false concept, that from the time we perhaps get our first dose of antibiotics as a child until we're adults, since most of us have repeated exposures to antibiotics, that we're sort of remodeling our microbiome, but the likelihood that it comes all the way back to baseline, I personally think, based on the data I understand, is small. And so this is, I think, a really important topic for early onset colorectal cancer, and has not been probed yet, because in the 1990s, maybe into the 2000s, our use of antibiotics, the sense was it was risk-free in most instances, and I don't think it is risk-free. So we're much tighter now. I'm an infectious diseases physician, so we're much more concerned about dose of the antibiotic, spectrum of the antibiotic, and how long we're going to take it. So our whole field is shifting towards shorter courses of therapy in the hopes of ameliorating some of these early epidemiological associations that are being reported.
And on top of this it's been for many years, again, anecdotally, you know, to quote unquote, fix the impact of antibiotics, you take a probiotic as well, right? So a lot of these myths are resurfacing as part of the new research.
Yeah, and there's some beautiful work on that point from the Elenoff group in Israel that suggested that actually probiotics delayed the recovery of the microbiome, which is one of the papers that I think struck a lot of us in the field as, you know, a cautionary note.
Thank you.
Can I just add something here?
Yes.
Cindy, do you think that as we characterize the microbes, the different species of microbes in the microbiome, we might be able to design probiotics that actually, you know, have a better effect? There's hope on that.
I do think there's hope. And I think it was the first wave of this was published in the New England Journal just a couple of months ago in the C. difficile field with series 109 that suggested that spores of firmicutes, which are very common in all of our microbiota, were able to decrease the rate of recurrence of C. difficile, which is, in my view, an exciting finding for the development of precision microbiome therapeutics to help repair our microbiome. So I do think we're on that path, but research is time consuming and takes time to try to work through all the details, and including the importance of patient safety.
Yeah, thank you, Jodi, for that question. I want to respect a question that someone has asked through the platform. It's a little bit more technical, but I think it's an amazing question. Let me read it. Many lower anterior resection syndrome, LARS sufferers rely on regular, often daily warm water enemas to function in life. What are the impacts of regular enemas on microbiome? What do you recommend for supplements, diet, medications, lifestyle management for LARS patient care in general?
So as an infectious diseases specialist, I don't have a lot of experience with those individuals. That's more in the surgical field. However, we do have information that suggests that the enemas are disruptive to the microbiome. And again, there's a repair process, so rebuilding your microbiome afterwards. And of course, that will be very dependent on the medications you take and the diet that you are taking. And so I don't think we have good answers to that very difficult clinical situation. But I think the best advice would be to return to a healthy diet, as there are a number of them published by the US government that are, considered sound choices in eating.
Great, thank you so much. To respect time, I'm going to close with the final question, and I want to end this on a positive note because I think it's been kind of at the crux of the matter. What do we need to do to increase good bacteria in our gut microbiomes? What are the things that we can do?
Well, I think healthy living. I'd love to hear Laura and Jodi's perspective, but I think what we keep hearing is that healthy living, while not a perfect preventative for any disease, is probably the way to go. So good diet, good exercise, sleeping well, all the things that sound like sort of boring maternal advice.
And no one does.
But the more we can think about those things and try to incorporate them into our lives, I suspect it will help us all be healthier.
Yes.
But Laura, please, and Jodi, please chime in.
Yeah, I just, yeah, I agree. I think that one of the things that I found is I know a lot of people, especially the younger people, when they're diagnosed, they want to radically change everything that they're doing. They want to become vegans. They want to do all of this. And, I think especially for metastatic colon cancer, I tell people that if you're comfortable making these drastic changes, then go ahead and do it. Okay, there's no harm. But if it's not comfortable and it's not something you want to do, then just do the best you can. And I think that that's real important. And I'll probably be proved wrong soon enough, and that's fine too. But, I think that we put a lot of pressure on ourselves, to change. And, so I'm sorry, got distracted, but all right. Thank you.
Thank you, Laura. Jodi, is there any, would you like to have a final word?
Yeah, I would just add to what Laura was saying, that we put a lot of pressure on ourselves to change, but we don't really know that the change that we're making is the change that's going to be effective. And so then the consequence is we put a lot of pressure on ourselves, and maybe that's a worse thing than actually, just staying the course that we were on. My father used to tell me everything in moderation. And so I tend to kind of think, keep it moderate.
Yeah. Sage advice.
I want to say one more thing. This is why I got distracted. I accidentally put the wrong link in the chat for the OPTIMISTICC project, but Maria put the correct link, and it's OPTIMISTICC with 2 C's. Just
That's the
FYI.
trick on this one.
Yes, it is.
Right.
Even I forgot. So thank you.
Right. And so just again, first and foremost, thank you so much to Jodi, to Cynthia, to Laura for participating in this panel. We have many more questions. We could probably go for the next couple of hours. This is just the beginning of this amazing work with this amazing team of people. You'll be able to learn more about the work that is being done by this collaborative through their websites, and we highly encourage you to take a look, learn more, and participate where you can. I'm going to pass the floor over to Barry for closing remarks. Thank you very much for participating today.
Thank you.
Thank you.
Thank you, Anne-Marie, for your wonderful facilitation today. And thank you, Cindy, Jodi, and Laura, as well as all of our other participants and presenters, not only for answering your questions at the end, but for this marvelous presentation throughout the course of today. We hope that you as participants were inspired by our researchers and our patient advocates, and that you will consider participating in cancer research yourself in the future, whether as a participant, a researcher, a patient advocate, or even as a donor. If you'd like further information on the OPTIMISTICC Grant Challenge, I'll repeat what Laura has already said, but it's OPTIMISTICC, OPTIMISTICC.org. Or for further information on colorectal cancer, please see our website at colorectalcancercanada.com, as well as the cancerresearchuk.org website. We look forward to any questions or comments that you may have, so please feel free to reach out to us at info@colorectalcancercanada.com. And we look forward to any comments that you may have as you review or want to see different versions or pieces of today's broadcast. So thank you once again, and I look forward to interacting with all of you on whichever platform we meet next.